Chapter 23, the elbow. In this chapter, you will learn about the common injuries related to the elbow. These include contusions, bursitis, lateral epicondylitis, known more commonly as tennis elbow, medial epicondylitis, known more commonly as golfer's elbow, and dislocations. We will also review basic concepts of elbow rehabilitation. Please use the presentation to guide you in your reading. The elbow consists of three bones: the humerus, the radius, and the ulna. The humerus is the bone that connects the shoulder to the elbow. When your forearm is supinated, which means the palms are up so that you can hold a bowl of soup, the radius is on the thumb side and the ulna is the long bone on the pinky side. There are two major epicondyles to the elbow. Epicondyles are protuberances or bumps on the bone. The medial epicondyle and lateral epicondyles are located on the humerus, and the olecranon is located on the ulna. When the elbow is flexed, the lateral and medial epicondyles, along with the olecranon process, form an isosceles triangle. Refer to the textbook for this diagram. The radius and ulnar collateral ligaments provide the stability to the elbow joint, allowing the humerus, radius, and ulna to articulate. There is a very large bursa that covers the olecranon, and this has the tendency of becoming inflamed. Refer to the textbook for diagrams of these bones and soft tissue. Review the muscles, nerves, and blood supply of the elbow using the presentation and the textbook. In the next section, you will learn about the common injuries to the elbow. We will discuss the assessment procedure as it relates to the particular condition. Please read the information from each slide as it corresponds with the textbook. Grasp your elbow and feel its boniness and how padding is limited. Contusions are painful because of this, and they can cause extreme bruising, swelling, and limited range of motion. They can also cause an Olecranon Bursitis, which we will discuss on the next slide. In Olecranon Bursitis, the bursa at the tip of the elbow becomes very swollen, usually due to a contusion to the elbow joint. Treatment consists of ice, compression wrap, and rest. This is especially necessary if the athlete experiences extreme pain and limited range of motion. Sometimes a physician will aspirate the fluid using a large bore needle and then compress the elbow joint to prevent the bursa from refilling. Lateral epicondylitis refers to inflammation, as the term ends with itis. It means inflammation at the lateral epicondyle of the elbow. The layman's term for this injury is referred to as tennis elbow. This is an overuse injury, often combined with poor mechanics. Oftentimes, the athlete will lead with the elbow, as in a backhand stroke in tennis, and with a flexed wrist, forcefully extend the wrist and make contact with the ball. The result is overstretched and overused extensor forearm muscles. Where the muscles attach at the lateral side of the elbow is often where the pain site is located. Weakness in the hand and wrist often develop with time. Even handshaking can cause intense pain. Refer to the presentation for pictures related to this condition. Treatment consists of resting the elbow from repeated movements that cause the pain, using an ice cup, and implementing ice massage numerous times per day. Massage, the use of a counterforce brace, and stretching of the elbow and wrist are also helpful. In extreme cases, often related to the professional athlete, surgical intervention may be needed to reattach the tight extensors. Medial epicondylitis refers to inflammation at the medial epicondyle of the elbow. This is referred to as pitchers, golfers, and javelin throwers' elbow. Again, just as in lateral epicondylitis, this is an overuse injury combined with poor mechanics. The athlete is leading with the medial side of the elbow while forcefully flexing the wrist. The result is overstretched and overused flexor forearm muscles. Weakness in the hand and wrist may develop, just as with the lateral epicondylitis. The same treatment suggestions apply for this condition. Please refer to the textbook for additional information as needed. Elbow dislocations are rare in sport, but they can occur. If this does, stabilize your athlete, implement the emergency action plan, treat your athlete for shock, and have him transported to the hospital. X-rays, pain medication, and reduction by a medical staff will occur. Immobilization followed by rehabilitation to strengthen the elbow will proceed. The complication to this injury is damage to the arteries and the nerves that travel through the elbow. Refer to this very comprehensive section of the chapter to understand the scope and sequence of elbow rehabilitation. Explanations and diagrams of exercises are included.